Hi, everyone. Thank you for those who have joined us today. We're going to give it just one more minute before we start. Okay. Hi, everyone. Thank you for joining us today. My name is Molly Penna, and I am our Vice President of Customer Success here at BrainCheck. Welcome to today's webinar. This is our inaugural reimbursement masterclass for Florida physicians and providers. This session today will be about 20 to 25 minutes. It will be recorded, and we'll send out the recording as soon as it's available. We will also publish it on our website. And also your mics are muted. So if you have any comments or questions, please feel free to put them in the chat box. At the end, we will do a Q&A session where we go over them. So let's get started. So before we jump into reimbursement, I want to quickly introduce you all to BrainCheck. We are an FDA Class 2 medical device. We are a cognitive assessment platform, and we're used by healthcare systems, primary care providers, geriatricians, neurologists, and more specialists across the United States. BrainCheck helps physicians and providers to be able to identify impairment early, take timely action, and get reimbursed for the care that you all are already providing to your patients. In today's event, we are going to share some valuable insights on how BrainCheck customers are enhancing patient care using the BrainCheck platform. Our platform tools empower providers with an all-in approach to cognitive care. We streamline the screening, assessment, care planning, and monitoring for all of your patients' cognitive health. So how do we do that? We have 3 core products. BrainCheck Screen is our first one, and this helps physicians and providers to efficiently determine if further cognitive testing is needed with our BrainCheck Assess. This can be done in as little as 3 minutes. BrainCheck Screen is not reimbursable, but it does help to establish medical necessity for BrainCheck Assess. BrainCheck Assess is our FDA Class 2 medical device. It helps to easily and objectively detect signs of cognitive impairment, and this can be used if you already have medical necessity. So you can either start with BrainCheck Screen, or if you already have medical necessity or a cognitive concern, you can start with BrainCheck Assess. And this is reimbursable, which we'll talk about. BrainCheck Plan is the last part here, and this helps clinicians to build, document, and deliver a comprehensive care plan for patients and their families for cognitive decline and post-diagnosis. Data collection is streamlined in our platform to allow for easy documentation and to make reimbursement seamless. Now, I'd love to introduce our billing support manager, Kathy Sager. Kathy Sager is an invaluable member of our BrainCheck team, and she is a fantastic resource for all of our customers. Kathy, I'll pass the mic over to you to introduce yourself and kick us off.
Thank you, Molly. Hi, everyone. I'm Kathy Sager, the billing support manager here at BrainCheck. I've been with the company for over 2 years and bring certifications as a certified professional coder and a certified professional medical auditor, along with a strong background in the medical field. My focus is on making your billing experience as smooth and accurate as possible, from helping with coding and compliance to quickly addressing any questions or issues that come up. At BrainCheck, we're committed to delivering not just great clinical tools, but also reliable, transparent support behind the scenes. and I'm here to help every step of the way. Now, just a quick overview of today's session. We'll be focusing on the appropriate time-based CPT codes, modifiers, and ICD-10 codes. Then we'll jump into Florida-specific coverage and reimbursement rates, how to use our insurance matrix to maximize usage, and review provider specialty type coverage criteria. Then we'll wrap it up with best billing practices and prior auth requirements before diving into our Q&A session. Now, the CPT codes for BrainCheck cover testing, interpretation, and cognitive care planning. CPT 96136 and 96138 are for neurocognitive test administration. Both are 30-minute time-based codes requiring a minimum of 16 minutes to bill. 96136 is administered by a medical professional. This can be a physician, a doctoral level clinical psychologist, clinical nurse specialist, physician assistant, or nurse practitioner. CPT 96138 is administered by a technician. This can be a medical assistant, a scribe, or any staff member, and this code must be proctored. CPT 96132 is for test interpretation and medical decision-making by the medical professional. It is a 1-hour time-based code that requires a minimum of 31 minutes to bill. And CPT 99483 is for cognitive care planning. It's not time-based, but typically requires an hour. This needs to be billed alone on its own date of service and only can be billed once every 180 days. Now, Florida Medicare reimbursement approved amounts are listed here by locality. You'll find Fort Lauderdale and Miami localities reimburse above the national rates, and the rest of Florida is slightly lower. But most of your payer contracts are negotiated at a % above Medicare, so you can expect higher reimbursement with them. Now, here are a few modifier and billing scenarios when billing these codes. Your administration code 96136 or 96138, and the test interpretation code 96132. These can be billed alone or together on their own date of service. In these scenarios, no modifier is needed. Now, where modifiers do come into play is when you're billing 96136 or 96138 and or 96132 with an office visit. In this scenario, you'll need to add a 59 modifier on the BrainCheck codes and be sure to assign a separately identifiable ICD-10 code for your office visit from the BrainCheck codes. You also want to be sure to check for internal payer edits that might require a 25 modifier on the office visit. This is commonly seen with Aetna, Blue Cross and Blue Shield, and Humana, or if you're going to be billing additional procedures on the same date of service. Now, your ICD-10 codes for medical necessity, you should refer to your Medicare MAC carrier, First Coast, for their LCD policy and billing article. The LCD provides policy details, and your billing article lists the CPT codes with payable ICD-10 codes for medical necessity. Now, most of your payers in Florida follow Medicare guidelines. You want to consult with your biller for specific policies. If none are listed, then you follow Medicare guidelines. Now, Aetna, they have their own policy, 0158. It has a limited list of payable diagnosis codes that support medical necessity, so you want to be sure when you're submitting claims for Aetna that you look at that. Telehealth. All CPT codes for BrainCheck are reimbursed via telehealth. Your administration codes 96136 or 96138 and your interpretation code, the 96132, are permitted via telehealth, either audio only or audio and video. Now, if you're doing the 96138 test administration by a technician, it must be proctored. Audio only or audio and video is accepted. Your 99483, your cognitive care plan, that must be face-to-face, audio and video. And this is also a permanent telehealth code. When you're submitting claims, your modifiers will be 93 for audio only and 95 for audio and video. Now, some Florida payers will require prior authorization for neuropsychological and psychological testing and interpretation, which may fall under behavioral health or medical coverage depending on the plan. Prior auth requirements can vary by the patient's coverage or provider specialty type. So an example, neurologists may not need a prior auth, but a primary care provider may. Major payers like Aetna, Cigna, Humana, and First Coast Medicare fee-for-service typically do not require a prior auth. Most managed Medicaid plans, for example, AmeriHealth Caritas, Molina, or the Sunshine plans, do require a prior auth. And you want to be cautious with snowbird plans. Patients that come from out of state, like AmeriGroup, Emblem, or Blue Cross and Blue Shield, some may require a prior auth. Now, the ways we make that easier for you, we have an example of a Florida insurance matrix. The purpose of this, it's a comprehensive guide to Florida insurance payer policies for neuropsychological and psychological testing. The data points on this include the payer, the insurance provider name, the line of business. It'll tell you what type of insurance this policy references: commercial, Medicare, Medicaid, Medicare Advantage. The state is Florida. The coverage status of whether the service is covered, including telehealth policies. Your prior auth requirements, if a prior auth is needed, with details on the specific codes or conditions. The document information will give you the link to the policy requirements, your billing and coding, references to links to the relevant guidelines, your authorization tools. There's a link to the prior auth lookup tool if one is available, and any forms if you're going to use that. Although the recommended way of submitting prior auths is for the payer through the payer portal. And then we'll also list notes for any additional contacts, specific conditions, or important details. Now, the key use case in this is it provides a quick reference for navigating insurance requirements for the neuropsychological and psychological testing in Florida. And then once you're onboarded, customers will have full access to state-specific insurance matrix as well as access to other states for those snowbird visitors. Now, BrainCheck screen. The BrainCheck screen is not a billable service. However, it plays a crucial role in establishing medical necessity for further testing with BrainCheck Assess. It supports prior authorization for the 96136 or 96138 and 96132. Now, this is a pass-fail assessment that provides one of two outcomes. The pass results fall within the expected range, and the recommendation is to retest in 12 months or sooner if medically necessary. And then the fail, further testing recommended, it prompts the need to schedule the patient for BrainCheck Assess. Now, when a patient screens positive, or if you already have a medical necessity based on clinical presentation or cognitive concern, then you can move on to the billable BrainCheck Assess with 96136 or 96138 and 96132. But before you administer BrainCheck Assess for your patients, you'll want to make sure that if prior authorization is needed based on the patient's plan. Now, as part of our commitment to your billing success, we offer ongoing pre- and post-billing support to keep your processes efficient and compliant. And our services include expected reimbursement rates that align with Medicare-approved amounts, billing tips, educational sessions to boost claim success, tailored insurance matrices that are state-specific with the CPT policy and ICD-10 code guidance. We have authorization guidance, step-by-step instructions to avoid delays, modifier and billing frequency support, documentation and audit tools with templates and reviews for accurate billing, secure eBridge collaboration, which is our HIPAA-compliant document center where we can share claim denial support, and dedicated billing support, ongoing help with all BrainCheck billing matters. And our goal is to maximize your reimbursement and streamline your billing process every step of the way. Now, our key takeaways: know your codes. 96136 if a provider or an MPP is administering assess versus the 96138 if technician, which is any staff member, is administering it. 96132 is for provider or NPP review of test results with the patient, and your 99483 is the comprehensive care plan post-diagnosis. For documentation, assess and plan reports are tailored to meet most of the documentation and time requirements to support billing these CPT codes. In telehealth, all CPT codes can be done via telehealth. You need to follow the guidelines. 96136 or 96138 and 96132 can all be done via audio only or audio and video. And reminder, 96138 must be proctored. And then your 99483, the care plan, must be face-to-face via audio and video. Florida specific, we share First Coast Medicare approved amounts. Refer to your contracts with other payers as they normally are negotiated at a % above Medicare. And your prior auth can be dependent on coverage or provider specialty types. Some may not be required. So I appreciate your time, and I will hand this back to Molly now for our Q&A session.
Thank you so much, Kathy, for all of that information. We will now turn to our audience Q&A. For everyone who's on the call, please feel free to put questions in the chat box and we will answer them in order. I've got a DM to kick us off. First question is, the payer matrix that you showed a little bit of a preview of, Kathy, is that accessible to folks? How do they get access to it?
Once you onboard, we go over all of that and we will share that matrix with you. It'll include all the states so you can check out-of-state policies for snowbirds, but you'll have full access to all of that information.
Perfect, Kathy. And I've also got a question regarding test administration. So for test administration, it says, if the test is administered by my MA, can I bill for the test administration code?
Yes. And a medical assistant is considered a technician. So anyone in your office that is a provider, an NPP, can administer the test. It's under the provider's supervision and bill 96138.
Great. And that is really, really helpful in terms of saving the physician and the provider's time and being able to use their support staff where needed to help with that test administration. I've also got a question, can I print all of this? So we will be sharing the recording of these materials. We won't be sharing the PowerPoint or PDF of it, but if you become a BrainCheck customer, then we will of course share all of this information and much more to help support your billing. You are welcome to use the screen recording however you would like though. I've got another question here. Can these CPT codes be billed with an office visit or an annual wellness visit?
Yes, the test administration and the test interpretation can be billed with an office visit or an annual wellness visit. You just want to make sure to apply your modifiers correctly, different ICD-10 assignment, and make sure that your documentation and time are noted separately from your visit.
Great. Well, that certainly helps to fit into already established workflows within a practice. We have a few more minutes for some additional questions, and then we will start wrapping up. Okay, I see a question. What is the most common diagnosis used for assess if the patient fails the screen or is concerned about MCI or mild cognitive impairment?
There R4 1.89, which is other symptoms and signs involving cognitive functions and awareness, is a very common diagnosis before a specific diagnosis is determined. Now with Aetna, remember I went over, they have a very shortened policy for payable diagnosis codes. Theirs would be R4 1.82, altered mental status unspecified.
Thank you, Kathy. I see another message. How often can I bill these CPT codes?
The test administration and test interpretation codes do not have any frequency limitations. However, it's important that medical necessity is supported for frequent testing. Your 99483, the cognitive care plan, that can only be billed once every 6 months or 180 days. And reminder, it has to be billed on its own date of service.
We have time for one more question. I'll check the chat. Okay, I see a question from Adam. How involved is the test examiner in test administration? Isn't BrainCheck fairly automated? So would their involvement be minimal? What does proctoring look like?
So taking a patient into a treatment room, explaining BrainCheck, making sure that they have, glasses if they wear them, to make sure that they're free of distractions, they silence their telephone. But it's a matter of explaining everything, handing them the device. Normally it's tested on an iPad. You don't have to stay in the treatment room, but as long as you're available. So if you're outside the treatment room in the hallway and the patient has any questions during the practice test, they can call you to come in and explain it to them. If you find that a patient may have difficulty with technology, it's probably a better idea for you to stay in the treatment room just to make sure they understand the practice test when they move on to the next one.
Yeah, that was perfect, Kathy. You hit the nail on the head. It's mostly the setup and then being available to answer any questions. Okay, I see another one. And this process meets the requirement for the testing codes, question mark?
Yes, it does. The report itself will help you to document the administration, what tests were done, and the time required to administer it, as well the provider's portion on the interpretation.
Great. I know I said one last question, but I think we've got a couple minutes if there is one or two final ones. So I'll leave the chat open for a few minutes before we wrap up. Well, thank you so much, Kathy, for the valuable information. Oh, I see one more. Are providers usually able to meet the 31-minute requirement to bill 96132? That's a great question and something that we've answered a lot for our customers. There are a lot of activities that count towards that time requirement. So it's usually not a problem. I'll let Kathy speak a little bit more to what those activities are.
Yeah, that's the provider going over the past medical history, like a recent annual wellness visit or referral notes from another provider, in addition to interpreting and reviewing the test results, coming up with a treatment plan, discussing it with the patient, family member, or caregiver, as well as the documentation of time in the chart note. So all of that equates, it's not all face-to-face. CMS states that it's not all face-to-face. It includes all of the activities leading up to it with doing the interpretation and getting all the documentation and discussion with the patient.
Yep. Yep, so not all face-to-face and also not all contiguous or in the same day. And as you can tell, there's a lot of activities there that the provider may already be doing as part of their treatment of the patient. I've got another question here. Do you see many denials from the different payers?
I don't really, the denials, like Aetna, for example, or sometimes Blue Cross and Blue Shield, they'll request notes because they're time-based codes. And when billing with an office visit, they want to make sure that the documentation supports the separate services. So that's what they're looking for. I have found that, helping customers with denials, sending the chart note and the assess report into the insurance company if they bundle it, results in payment.
Thank you, Kathy. And we've just got a note. Thank you for your time answering all my questions. Thank you for your time joining us today. And with that, I think we will start to wrap it up. Thank you so much, everyone, for your time today. We really appreciate it. If you would like to learn more about BrainCheck, we've got some contact information here as well. But if not, we'll let you get back to the rest of your week. Thank you so much, everyone.
Thank you.
Thank you. Bye.